President Uhuru Kenyatta has directed investigative agencies to hasten investigation into alleged graft at the Kenya Medical Supplies Authority and present their findings within 21 days. The head of state saying that in line with the zero tolerance to corruption policy, no one will be spared irrespective of their status in society. The directive came in the wake of reports indicating that huge amounts of money could have been lost through dubious deals in the procurement of critical supplies meant to contain the coronavirus pandemic. Let's take a look.
On Wednesday, President Uhuru Kenyatta made his 11th address to the nation on COVID-19 since the pandemic struck in March. The president taking issue with those involved in corruption despite the zero tolerance to graft policy, directing agencies handling the graft allegations at the Kenya Medical Supplies Authority to conclude investigations into the matter within 21 days.
That all persons found to be prima facie culpable as a result of those ongoing investigations should be brought to book, notwithstanding their public office or their political, and for that matter, their social status.
Further, the president extended the dusk to dawn curfew for an additional 30 days, with the closure of bars and nightclubs set to continue.
The nationwide curfew that is currently enforced between the hours of 9 p.m. to 4 a.m. daily be and is hereby extended by a further 30 days. In the next 30 days, I have also directed that the Ministry of Health, in conjunction with all bar owners, will develop self-regulating mechanisms as part of their civic responsibility to their clientele in order to allow their resumption.
It is, however, relief for restaurant owners and eateries as their hours of operation were extended by 1 hour, with the prohibition of sale of alcohol by licensed hotels with residents being vacated.
The prohibition against the sale of alcohol by licensed hotels with residents is today vacated. But the closing time for restaurants and is hereby varied by 1 hour from 7 p.m. to 8 p.m. effective the 27th of August, 2020.
Meanwhile, the maximum number of people set to attend funerals and weddings was reviewed upwards to 100 persons in line with recommendations from the Interfaith Council.
Is reviewed upwards from 15 to 100, with all in attendance abiding with the Ministry of Health protocols.
The head of state has further directed the Cabinet Secretary for Health, acting jointly with the chairman of the Council of Governors, to constitute a national reference group on COVID-19 to review the efficacy of the country's response to the pandemic so far, record lessons learned and submit them to the sector nationally and in counties, position healthcare as a driver of the manufacturing agenda by ensuring preferences given to local manufacturers in procurement of pharmaceutical and non-pharmaceutical products, formulate strategies to identify weaknesses within the healthcare system, and recommend ways of improving national response to emergencies.
Our research institutions, which are already doing great work, can now come together, bringing on board all relevant stakeholders locally, but also partnering with those internationally, and together sharpen their focus on the development as well as the testing of COVID-19 vaccines.
The presidential address came on a day when 213 people tested positive for COVID-19 out of 4,017 samples tested, pushing the total caseload in the country to 33,016.
Our health experts have indicated that levels of the positivity rate countrywide have fallen from a high of 13% in June to 8% in August. This is very encouraging, and it means that if we keep our civic responsibilities high, we have a chance to reach the 5% positivity rate recommended by the World Health Organization for a total reopening of our economy and country.
The number of recoveries rose to 19,296 after 241 patients were discharged after making full recovery, with 124 being from home care program and 117 from various hospitals across the country. 5 more patients, however, succumbed to the virus, pushing the total number of fatalities resulting from the contagion to 564. Nancy Okware, Channel 1 News.